What I'm going to talk about is a bunch of programs that we have for healthcare training. Now, I'd like to start by saying that the reason we have these programs is that they're paid for by the government because there is so much need for people to work in the healthcare field, especially in Philadelphia, well, in all big cities, but right here in Philadelphia. So in the United States, or at least in Pennsylvania, the lowest level of healthcare worker, like the first entry level, it's the first level of education and of healthcare worker, and they are people who go and work in people's homes. They don't work in hospitals or nursing homes, only in people's homes. It could be an elderly person, or it could be, well, anyone who is sick and stays at home. And sometimes these people, the patients are, they only need it during the day, sometimes they need it at night also, sometimes on the weekends. That's actually one good thing about this kind of job, is that people who get this certification, you can pretty much choose your own hours because they need people all around the clock, every day of the week, to go somewhere. So there's many jobs available, and any shift that you want. You could work 9 to noon, you could work a full 8 hours, you could work just nights, just weekends, just days, whatever you want. The pay is not wonderful. It's about $11, $12, or $13 an hour. But that's why we don't want people to stop at that level. We want you to use that to go to the next level, at least the next level, which is certified nursing assistant. And when you're we call that CNA. When you're a CNA, then you can work in home care, or in nursing homes, or in hospitals, and you can make up to about $18 an hour, which is, not a bad wage. And you can often get benefits. So we like to see people use the HHA to get into CNA, and then maybe even go beyond that to becoming a nurse. Now, at District 1199C, which is the agency where I work, we have, as part of our own agency, a healthcare training institute. It's like a private, state accredited, state approved school inside our agency. And we teach home health aide, certified nurse assistant, and we have a licensed practical nurse school right in our agency. Okay, so I'd like to tell you what is special about our program. At the first level of training for home health aide, we have it in combination with advanced ESL. Now, this is really important because when our English students, our ESL students, have tried to go into health career training, the English has been too difficult for them. They have trouble learning the medical English and the healthcare. So in our HHA program, it's 4 afternoons a week. 2 days, you study the nursing content that you need, how to take care of the person at home, how to change their clothes, how to help them, how to take blood pressure, how to take temperature, all the medical stuff, the skills that you need. And the other 2 days a week, you study medical English. Exactly the English that goes along with learning those nursing skills. Now, when you finish the program, you get a certificate from our school, which is called the Health Technology and Training Institute. You get a certificate that shows that you have done 88 hours of home health aide training. Many of our students then go directly into our Certified Nurse Assistant program. And they come back and they tell us, we could never do this program this fast if we did not already know that English, because it's just too much. It's all the nursing content and the English, if you've never seen it before, it's too much. We also have had students who go to different career training. They do our HHA, home health aide, with the English as part of it. Then they go to Community College of Philadelphia and take dialysis tech. Dialysis is when you have kidney failure and you have to go into a center 2 or 3 times a week and they filter the blood because your kidneys are not working. And they have technicians there that hook you up to the machines and monitor your blood pressure and your pulse and everything. And we just had one of our students do that program and finish it perfectly. We have another one of our students who studied HHA with ESL and then went into a training program for dental hygienist. They make really, really good money. So this helps you start any health career path. But like I said, it's a good starting place because it combines the English and the health care together. And then you can go into one of these other programs. You have to be in our English classes for a few weeks before you start the HHA. This is state rules. The state rules all of this because they pay for it. So our next HHA class is coming up in April. So by the first or second week of March, which is right around the corner, you would have to be in our English class for a couple of weeks. First, you study home health aid here on the left. And you can make $10 to $14 an hour with that certificate. This is the one where you study 2 days a week of medical English and 2 days a week of nursing skills. And because we have the Health Institute in our building, in our agency, we have a whole nursing lab. It's a huge room with hospital beds, with fake people in them, and you practice making the bed and taking temperature and getting blood pressure, changing the linens, everything, washing your hands, just every nursing skill. There's a list of like 27 nursing skills, and you learn them in the lab. You go in there twice a week and you learn all of those nursing skills hands-on. And at the end of the class, you have a written final, but you also have a lab final where you go into the nursing lab and you have to show that you know how to do these skills. All right, so that's the HHA. It's free, paid for by the state. Next would be the CNA that I talked about. That one costs $1,500. Now I have to say that, but as long as I have known the program, we always get funding, but that's not always from the state. It's also sometimes comes from like Citizens Bank, but I've never seen anyone have to pay for it yet. But we have to say that there is a possibility that sometime you could have to pay for it. But so far, I have not seen anyone that had to pay for it, okay? Now, the LPN, Licensed Practical Nurse, over here on the right, they make amazing money. And that program does cost $18,000. There are 2 ways to do this program. About 90% of the places that offer LPN, Licensed Practical Nurse, you have to go 10 months full-time from 9 to 5 every day for 10 months. And it costs the same amount. We are one of the only schools that lets you go part-time for a year and a half. So what we want our students to do, and really our students don't usually have the ability to not earn money for almost a whole year, right? That's a lot. You'd have to have $18,000 to pay the nursing and another $20,000 to live on, right? So what we encourage our students to do is get their CNA, and then they can be working for $15 or $16 or $17 an hour, even 2 or 3 days a week. And then our nursing program is 2 nights and Saturday, Sunday mornings for a year and a half. And that way, you can be earning decent money while you're studying nursing. And on the weekends, for example, one weekend you come in for classes, Saturday, Sunday morning. The next weekend, you go and work in a hospital or a nursing home, Saturday and Sunday morning. So you're doing your classes and your practical time on the weekends. And then you have classes also during the week, 2 nights a week. Now, CareerLink will give you one time, only one time, $6,000 to study. And if you are interested in this program, the first thing you need to do, they won't even talk to you until you go to an information session. And I can talk to you when I'm finished about how to set that up, okay? Okay, so if you do not have a high enough level of English yet to get into one of these other programs, then the HHA program is where you should start, because you learn the medical English and the first level of nursing skills together. If you can pass a test for native English speakers, right? This is where you have to take a test for people who are not from other countries. You take the same test as all of the English speakers take. If you have a high enough level of English to get into this program, then you should go directly into this program. And then you need an even higher level of English to get into the nursing program. And if you already have that, you should do that. We have at my agency what we call pre-nursing classes. It's like 6 or 8 weeks, and all they do is prepare you for that test. So if you take the test and you're close, like if you're way down here, pre-nursing classes are not going to help. But if you're close, you can come to our pre-nursing classes and then take the test again. But if you're way lower, then you need to think about starting at the CNA or the HHA, okay? Because for the HHA, you can still be studying at the ESL level. For CNA, you have to already be at the English speaker level, and for LPN, you have to be at an even higher, like college English level. Were any of you in healthcare in your home country? I would be interested to hear, why are you thinking about healthcare? The thing is, like, I lived in Peru for many years, and in Peru, nurses, they don't make any more money than a waitress. But in this country, any healthcare career, there is a huge need, and it pays very well because there's just so much need. You can say, okay, I'll work Monday, Wednesday, and Friday mornings, or basically pretty much whatever you want, because there's a big, huge demand. We have people, like we just finished an ESL HHA class in February 14th. And the next week, we had 2 agencies that hire healthcare workers come to our office and talk to people and interview them right in our office. So it's a very good path to be on. And we help you start when you're still at the ESL level. It's free. You just have to come and you have to study in our English program for a couple of weeks before you go into the program. If you are interested in any of these, the best thing to do is text me. If you text or email, tell me what program you're interested in, and the first thing we will do is make an appointment for you to come in and take whatever test goes with the program you're interested in, okay? And if it's not my program, then I will put you in touch with the person who runs the program that is more appropriate for you, okay? And I would love to have any of you come to our agency. I hate to think of you finishing here and not having a plan for what to do next. And, I might be able to help you with that, okay? I will say that in our HHA ESL class, you get the books, uniforms, you get your equipment, which is a stethoscope, a blood pressure cuff, you get all of that, and we've been able to provide transit passes as well.
Oh, great.
So we really try to cover you.
Wow.
And then, like I said, most of our students have gotten into the CNA right after HHA, but they say over and over that HHA was really important because it helped them learn the medical English. And I have had in this HHA class doctors. I have a doctor from Mali, a doctor from Haiti, because they want to come here and they want to take the medical test, but they have so much to learn in order to be able to pass that test to get a license as a doctor here. So they start here with the medical English learning, and then they can work here, at least in the health field, while they're studying to get their medical license here in the United States. Like the doctor from Haiti did the HHA, now he just finished CNA, and he's gonna work and make money while he's studying and getting his credits and everything evaluated from Haiti so that he can work on getting his medical license here. I had a doctor from Mali also who she's working on it as well. But they come here and they're your age, so even if it takes them 5 or even 10 years, they still have 30 years to be a doctor here. I did have one student who came here when he was almost 60, and he was a doctor in Afghanistan, but it wasn't worth it to him to do 5 or 10 years to get his medical license here and be 70 when he gets his license. Mm-hmm. So he actually took the HHA and the CNA, and he's just working part-time as a CNA, and he's very happy because he's still helping patients, and he's still in his field a little bit. He realizes he doesn't have the same status as a doctor, but he gets to work in his field, he gets to make some money. I mean, there's many reasons why these programs are good for people. So what you need to do is get in touch with me through email or text. And if you text, say who you are, and then we'll talk in more detail about your particular situation. And then I can arrange for you to come to our agency and get orientation to whatever program is right for you and take whatever test you need to get into that program. So I can't tell you any more than that right now because it depends on each one of your situations. Yeah. And then we'll go on an individual basis to see what you need, what level you are at, and what you're interested in. Okay? So that's really the only next step. Everybody would start with taking an ESL placement test. And if you place too high for ESL, then we send you directly to CNA or directly to nursing, depending how high your score is. If not, then we start looking at the HHA with the ESL so that we can start teaching you nursing and get your ESL up as well. This last class that I just had, when they started, their English skills were at about an American 5th or 6th grade level. And when they finished the ESL, they were all out of the range considered ESL. So they had all tested too high to be considered ESL students anymore. And the reason is because they were not just studying English. They were using English to study another area, and a difficult area. I mean, that book is no joke. It's full of medical terms and how the body works, and it's no joke, that book. It's at a high level. And they work very hard in this class because it's the English and the nursing together. But then they all placed out of ESL, and now they're all at a level of like a high school student English. So CASAS is the ESL placement test. You come in and there's a booklet and you just go through it, and it's reading and answers. So there'll be like either a sign or a little article and then A, B, C, D, and you just choose which answer you think is correct. And it takes, altogether it takes a little over 2 hours. There's 2 parts to the test. And you'll just come in and sit right in my office with me at a table and sit and take the test. I'll get you water and you can relax, and there might be other people there doing it as well. It's right by the City Hall. It's at Broad and Chestnut. Yeah, Broad and Chestnut. Very close. It took me 5 minutes to get here. And this is something you should know before you even show an interest. First, you have to come to the English classes, which are 2 mornings a week, Tuesday and Thursday, 9 to 12. But if you want to do the HHA or the CNA, that is more of an all-day thing. The HHA is Tuesday through Friday, right? Tuesday, Wednesday, Thursday, Friday, from 11 to 4. And the C for 3 months. And the CNA is only 2 months, but it's 4 days from 9 to 4. So it's fewer weeks, but it's longer days.
Yeah.
And then we have GED. We use those GED classes for different things. Like we had a couple students who did HHA and did not have the math scores to get into CNA. So they went over to GED and took a couple months of math classes and then went back and took the test again, and then they could get in.
But those GED classes are available to anybody, not necessarily they need to be interested in any of the
Yeah,
healthcare
anybody.
certificates, right?
Anybody in the community in Philadelphia.
In
You don't
the-
have to be in healthcare, you don't have to be an immigrant, you don't have to be,
That's
you just have to
okay.
live in Philadelphia,
Okay.
and they're free. And then the LPN is 2 evenings and Saturday, Sunday mornings for 18 months. You have to pass the TEAS test, it's called. It's like a college level English, math, and science. You have to go to an info session before they'll even let you sign up for the test or anything. They know everything at the information session. They know different ways to get funding, to help pay for the class, and it's so, yeah. The way I understand it is that CareerLink will give you one time in your life $6,000 towards education. And I mean, they know, they're the experts. That's why they don't want us saying very much, because they know everything right there at the LPN school, because they are the experts. Our executive director likes to say we're a one-stop shop. We have like almost everything, but whatever it is, we'll help you. And if we don't have it, we'll help you figure out where to get it. But yeah, we have everything, and just text me or email me, and we can figure out exactly your situation and where to start you. To get into HHA, you don't need any documents. But to get your certificate, you have to have a social security card. And to get into CNA or LPN, you have to have documents. Now, you can take HHA without documents. You can't get your certificate, but you can put on your resume that you did the course, and they can call me and I can say, yes, he or she finished the course. And I would also like to say that with these new rules about not using benefits from the state, like that it'll hurt your chances to become a citizen if you get welfare or food stamps, free classes do not count as that. So it does not hurt you in any way to take these classes. In our grant to teach the courses, we are not allowed to say no to people who do not have documents. And yet, at the same time, we cannot give them their certificate, because on the one end, they're coming in under an ESL program.
Okay.
But at the other end, they're graduating under a school for everybody, and everyone to have that certificate has to have their social. I look forward to hearing from you guys, so text me or email me, and then we can talk about your specific details and what would be best for you. And get connected. Like, I don't know everything that's around, but I could say to you, okay, call CCP because they have a lot of medical programs, and find out what they have and how much they cost and how long they last. Because, there are ones that take 2 whole years. And then there's like dialysis tech, which is 3 months. So, okay, I have to say that's one good, well, actually, I could say that about NSC and where I work. We really look at each person as a person and what is best for you, what is best for you, what is best for you, and we help you get that.